something in the neck. But I do know that she was very focused on the MRI, that slap lesion. She would love to not go for the surgery, but couldn't see any other way because she was already failed so much conservative treatment. So in her mind, she was going for that slap repair. Thought basically it would be interesting, and a lot of clinicians ask us these questions in courses. I would love to see how the McKenzie method deals with a slap lesion. All right. And what do? We classify them. We still go through an assessment and we classify that patient. And then if that's relevant, it's a different story, but it's got to be assessed properly.
Yeah. At the end of the day, we're jumping way, way ahead. But if at the end of the day you discovered, I think this is due to the slap lesion, what's your classification?
If that's due to a slap lesion, it's got to be structurally compromised. It's got to be structurally compromised. Now, I think we can go into quite a deep debate here. What would that look like? Is that a structural compromise, and where does the lesion sit? Don't know if I'm going to break the discussion here. If I say, again, if we classify that as a contractile dysfunction, is that a slap lesion? I don't know if I maybe should take that out of the discussion, because that's on a higher level. There's some debate about that. What is that going to look like? What does a true slap lesion look like, Jason?
Right.
Is that a contractile dysfunction? Because that's right where the bicep tendon inserts. I don't know. But let's rather leave that out of the discussion here, because I think that will complicate things dramatically.
Sure. Well, it does. I mean, it's relevant discussion. I think certainly, again, we're jumping way ahead and assuming, coming to the conclusion, okay, if we have a patient that has a slap lesion and it is the cause of the symptoms, and what does that look like? Well, that would be something that would be not responding, of course, to mechanical testing in any rapid way for sure. And even slow, gradual improvement may not be showing like a tendinopathy might respond, because you would see, some form of observable improvement. And our senior instructors might say 10 to 14 days, or the patient's going to start describing some measure of improvement, if I'm not mistaken.
Yeah. And Jason, that's the thing. If this was going to be a symptomatic slap lesion, then it means that there's no response, no derangement response, no response, contractile or articular dysfunction. It's got to fit that other, no postural syndrome. It's got to fit that other box. And how exactly that would present, we can discuss. Maybe it looks like a contractile dysfunction that just doesn't improve, like you say, that 10 or 20% in 2 to 3 weeks. So no response. Yep.
Month after month, new guest experts sharing actual patient cases, and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.